Welcome to ESC TV. My name's Professor Peter Grant. I'm an academic diabetologist from the UK, and I have with me today Professor Lars Ryden, who is a senior cardiology professor at the Karolinska Institute in Stockholm. We're going to discuss the guidelines for diabetes, prediabetes and cardiovascular disease, which have been published in the European Heart Journal today. Welcome, Lars.
Thank you very much.
I'd like to start by just asking if you could explain to us why you feel that guidelines bringing these two important conditions together are relevant in clinical care today.
Well, because people with diabetes are very many, and they are increasing at a very high speed. And this population of patients are actually seen by two categories of physicians, those with a main interest in diabetology and those in cardiology. And the problem is that their management, their proper management, is rather complex. So we in the cardiological field has to learn from you who are diabetologists, and you have obviously also to learn a few things from us. And to merge these two specialties in a world which becomes more and more specialized. Cardiologists can be very good at one coronary artery branch. That doesn't take care of a patient. And you may be very focused on, for instance, glycemia, but you have a complete patient with potential cardiovascular disease to take care of. So we need to merge.
And do you feel there's evidence that by going through this collaborative approach, we have improved diabetes care for our patients?
Well, we know from different surveys that the care of this type of patient is not the very best at the moment. And there are a long way to go, and I am absolutely convinced that practical guidelines, as these are, and in some ways also simplified since the last version in 2007, that will help. But it doesn't automatically change behavior in physicians and nurses. So we have to educate, and this is one opportunity to distribute the information that they are available and they are good to read.
Could you tell us briefly the major changes that have been made to the guidelines on this occasion?
Well, yeah, one important change is that the diagnostic of diabetes has been simplified. You can start off with a fasting glucose and a glycated hemoglobin. However, people with cardiovascular disease have a very high risk of having diabetes or pre-stages to diabetes. So if you don't get a very clear answer, you have to make an oral glucose tolerance test as before, but you don't have to start with it. This is one simplification. Another simplification is that we have now abandoned the use of complex risk instruments to categorize people as having high risk, very high risk, or moderately high risk. We just say that if you have diabetes, you are at a very high cardiovascular risk. If you have diabetes and a cardiovascular disease manifestation, you are at an extraordinary high risk. So you can, in a very simple way, tell your patient where he is. Another important new feature is a simplification of dietary instructions, and that we have abandoned to get people to lose weight. Weight stabilization is a key word now, rather than weight loss. And finally, the instructions for coronary interventions are different. Optimal medical treatment can sometimes be used in less complex coronary artery disease. In complex coronary artery disease, bypass surgery has shown superior to PCI.
Thank you. And could you finally and briefly please tell us where you think the guidelines will be going in the next 5 years?
Well, I hope that we will have ample opportunities to educate people about the guidelines and their contents in the next years or so. I also hope that we not will wait from several years, actually 6 years, for updating the guidelines. I would like to see a system where very important new trial is taken under the consideration of the task force and its chairs, and that we on a web-based format can say, do they change or in any way influence our management of patients? So the guidelines should be up to date in every minute.
Thank you very much.
Thank you.
ESC Congress 365 is your free access to ESC Congress content all year long.